There's this concept in healthcare today called value-based healthcare. So if you think about the way you get healthcare today, you have a procedure, you have a treatment, you have some kind of a office visit, and you pay for each one of those things. Now, I was talking with one of my clients the other day, and they were looking through my invoice and they had some questions. And they said, When we pay for a user, what does that mean? What do we get?" And when we pay for a workstation, which is just a computer, what does that mean and what do we get? And so what dawned on me is that in healthcare today, there is such a fixed mindset as it relates to pay per service fees and how healthcare actually generates their revenue. But there's this thing in healthcare today called value-based healthcare. And the idea is that it's focused on outcomes. So imagine if your general practitioner could talk to your gastroenterologist and they could talk to your ENT and they could talk to your OBGYN. Imagine if all of your doctors were able to communicate with each other and share your information to understand some of the things that you're struggling with when it comes to your health. Now imagine if they could get together and focus on getting you specific results. I just want to get up in the morning and have energy. I just want to feel good. I just want my eyes not to be bloodshot all the time. I just want to not have this pain in my back. How can I fix those things so that I can have a higher quality of life? Because we as the patients, that's what we want. And so this is what value-based healthcare aims to focus on. Now, here's the problem when it comes to IT in healthcare. Because they're so accustomed to this pay per service fee model, they also believe that the same thing holds true when it comes to technology. So we have something in our business that we like to call value-based IT. It's the exact same concept as value-based healthcare, but instead of focusing on your physical health, we focus on your business health and how we use technology to get you the outcomes that you're looking for. So when you look at my invoice and you see how I charge you for a user or I charge you for a workstation, that's just a way to charge you for all of the other services that you get. And really, what's most important aren't even the services, it's the outcomes that you achieve. One of the things I say to a lot of people is most IT vendors out there, they make money the more problems you have. And the difference with me and with Continuous is the less problems you have, the more money we make. Now, the reason that is because you should be paying me for good outcomes, for great outcomes, and that means fewer technology issues. If we can utilize our time and our efforts to focus on better outcomes for you by understanding your business, because we're not having to sit there and fix printers all day, that's a good thing, and that's what you want to be paying more money for. So think through value-based healthcare and how that relates to your IT. That is specifically and exactly why Continuous provides value-based IT.